I'm just waiting for the little recording message. Okay, that's started recording. Yvonne, do you want to do any introductions first, or do you want me to just jump straight in?
Well, you know myself. Guys, do you want to go around? Leanne, do you want to go first? You're on top of my screen.
Hi, I'm Leanne, part of the operational leads in health records.
Hi, Liam.
Hi, I'm Joel. I'm part of the operational leads in health records.
I'm Kerry. I'm the health records trainer.
I think we've met James. I'm part of the operational lead, Joanne.
Hi, Joanne. Yes, I think we have met on previous calls.
Yeah.
Haven't we? Yeah, absolutely. Okay, so thanks for your time today, guys. This session is to give you a bit more of an in-depth, deep dive into the system that we've implemented for the digitisation of the health records at your trust. So obviously, it's an ongoing project. It's been going on best part of a year now, I think, isn't it, Yvonne, since we initiated the project, and there's multiple different streams of work going on. But ultimately, we're looking at obviously getting the records digitized and into a system that can allow the clinicians to consume those records rather than via the paper way that they're doing at the moment. So the system that we're using is called Filer. It's by my company Encodian, and it sits on top of a piece of software from Microsoft called SharePoint. And you're already using SharePoint in the trust if you're familiar with the Chubb system. That uses SharePoint as well, and it has a very similar feel to it. So there's multiple parts of the system, and I thought probably a good idea just to give you a quick high-level overview of the different moving parts in there, and then talk about the bit that we're going to look at today. So we've talked about Chubb. So Chubb is a system for the secretaries to author correspondence and for the clinicians to be able to approve it. And historically, once those correspondence were approved, it would then go into a separate SharePoint repository where they could be retrieved and looked at by the clinicians. That's going to be slightly changing, which I'll cover off. The other thing's the scanning. So I'm sure you're aware there's a project going on to implement a scanning pipeline, which is being done by one of our partners called Quadient, and they'll be installing, if they haven't already done, install scanners into your department so that you'll be able to scan paper and then have it digitized and go through a validation pipeline and ultimately end up in the system that we'll be looking at today. There's the Restore piece, which Restore are a scanning bureau, and they'll be historically back scanning your historic archive of records and into the same system. And then we've got the touch points with various trust systems, things like Badgernet and TextFlow, where documents are authored via digital dictation, for example, or in the Badgernet system, and they filter through. And ultimately, they all end up in a system called Filer. And Filer is one of our products, sits on top of SharePoint, and allows the clinicians to view all those records. And Filer is what we're going to be looking at today. So there will be a separate session in a couple of weeks' time, I think, on the 28th, where our partners from Quadient will be taking you through the scanning piece and how that works and how you scan and digitize those bits of paper and how they ultimately end up in Filer. I don't believe we need to dive into Chubb at all, because I don't think you guys will be touching Chubb as a piece of software. It's more from the secretaries and clinical side. But Filer is where you'll be able to go and see the records once they've been digitized and carry out your validation, verification, and there's various bits of admin functionality that you guys will have access to that you'll be able to do on those particular records. I'll share my screen shortly. Because I'll be sharing, feel free to shout out if you've got any questions at any point in time. Don't bother using the Teams thing with putting your hand up, because I won't see it. So just call out if you've got a question as we're going through. It's absolutely fine. I'd prefer it to be interactive so that you guys get the most out of the session. Just going to share my screen, and I'm going to drop off camera. Feel free to drop off camera as well if you don't want to be on there. There we go. To accompany this session and afterwards, I'll distribute this user guide. So this is a very detailed user guide and it covers a lot of the functionality that we'll be looking at today. I understand that the training team at the Trust will also be producing sort of more succinct user documentation to go along with that based on this user guide. But this user guide is for you to use and distribute and amend and hack to pieces and do whatever you want to do with it. It's absolutely fine, and it carries quite detailed information about the different functionality in the system and how it all hangs together and works. I'll share that after the session. We might refer back to it as we're going through. So let's jump in. Can everybody see my screen? Okay. And it's okay size-wise?
Yeah.
Yeah.
Super. Okay, so there's three main parts to Filer. There's the user interface that the clinicians and the end users will interact with. There is administration functionality that you guys will have access to that allows you to carry out further operations on those documents and the system. And then there's administration functionality that your IT team will have access to, which gives sort of high-level configuration and health information about the system. So we'll look at all three parts so that you've got sight of it. But what we're going to start with is what the users have access to, and then we'll relate it all back to the admin functionality. Okay. The other thing is I'll share all I'm demoing in our development environment now because of the way I have to connect to the Trust environment. It's not a great experience. But what I'll do is I'll share the URLs afterwards, after the session, so you guys will be able to access the test system. We'll give you access to that and the admin functionality, so you'll be able to go in and have a play around with yourself in the test system. Okay, so what we're looking at here is the entry page to Filer. Filer's our product name for it. I believe in the Trust, the whole solution as a whole will be known as Chubb Plus. So when people refer to Chubb Plus, it will refer to the existing Chubb component, the Filer component that does the actual, it's the repository for the documents, but also the scanning pipeline that you guys will be using as well. Collectively, that will be called Chubb Plus. So entry point in that the users and clinicians will go into is this screen here. Very simple search. We've got a number of different configurable search criteria here that have been agreed upon. Additional search criteria can be added in the future. It's part of configuration. This is the values that have been arrived at as part of the design process that we went through. The main one being the CRN hospital number. So what you can do is you can pop that in there. And what this does at the moment is it goes off to the PMI database that the Trust hosts and does a search across that database for patients with that CRN and returns some results. Okay. We're going to be changing that as part of an upgrade, if you want a better word, and it'll be going direct to PAS to get the most up-to-date information on patients. The PMI at the moment is a snapshot of the patients held in PAS and isn't a complete record, so we'll be changing it imminently to use an API that directly talks to PAS. So we did a CRN search there, but just to show, so we could do a surname search. Let's show with Smith. Surname search, obviously, potentially get more than one record come back. So we've got two people with the surname Smith there. We can also search on, say, NHS number. Make sure I get the right number of characters. 2, 3, 1, 2, 3, 1, 2, 3, 4. And obviously, it works out the fact that the NHS number is in a different format as we're doing the search. So once we found the patient that we're interested in seeing the records for, you just click on them and it'll launch a new browser tab with that patient's records in. The search screen will still remain open in that, so you can carry out further searches, launch them in additional tabs if required. Okay. Like I said, feel free to jump in with any questions at any point about any bits of functionality as we're working through, or again, save them up for the end. It's absolutely fine. So what we're seeing now is the records that have been digitized for this particular patient. Okay, and I'll just take you through all the bits and pieces that we've got on the screen here. So starting at the top, we've got what's called our demographic banner. You're probably familiar with these. Lots of NHS systems have this sort of information banner about the patient at the top of the screen. It is configurable, and I'll show you how that can be done in the admin functionality. But essentially that goes again at the moment to PMI and pulls that demographic information down about the patient. So when the user's looking at it, they can see the up-to-date details of the patient that they're currently looking at.
James,
Yeah.
I'm assuming obviously the alerts have not been pulled through yet, so they're not on there as an icon or anything. No.
That's correct, Joanne. Yeah.
Right,
So
okay.
that's a separate piece of work that's been commissioned. That as soon as we've got this live, we'll be doing the update for alerts. But we'll work in exactly the same, that API I talked about that's going to talk directly to PAS.
Yeah.
There's a bit of work that the IT team at the trust are doing to expose the alerts via that API, and then we'll be able to make a call into it and bring up-to-date alert information back, and it will be displayed in the top right here underneath in the demographic banner.
That's great. Thank you.
No problem. So demographic banner, we can collapse it. Want a bit of screen back. We always leave what's called the primary identifier, which in your case is the CRN and the patient's name on display. And it can be expanded again if you want. Okay. I'm going to come back to these controls at the top of the screen. We'll go through these bits down here first. So just moving down the screen, we've got what's called the classification. So this is how we structure all the records into the different pots and categories and subcategories for and ultimately down to the different types of documents that they are. So this is a piece of work that's been ongoing between ourselves and Nikki Wallace and Yvonne to determine that classification structure. But what I'll say is it is configurable. So nothing's set in stone. It's not hard coded. If at some point the classification structure doesn't work for the trust, or new categories need to be added or new subcategories, it can all be done via configuration. But what we can do with the structure of the classification, it just allows us to explore the patient's records and see documents that have been categorized under the different categories. And you see as we go through, so I've clicked correspondence there, we've got a list of subcategories or document types. So if we click clinic letter, we're just going to see the clinic letter. We click infection sciences, we'll just see the letters that relate to infection sciences there. You can always go back to see the all documents view at the top. Just touching on the legacy ones. So the legacy ones are the ones that Restore will be scanning. They'll be coming through and they'll be split up. I haven't got a full set here, but they'll be split up along specialty lines. So the acute case note will be the whole case note, and then the different specialties that we've identified in those case notes will go into a different category, and the user will be able to drill through each one. So that's where the legacy. But also we're doing a piece of work so that you in Health Records will be able to scan a full case file in the same way that Restore is scanning a case file as a legacy case file, and it'll go through and it'll be stored in this same structure.
Can I just ask if all the folders always appear in the blue banner, or is it just folders that have contents that will appear there?
Great question. So by default, we show all of them. This little icon up here allows us to hide ones that don't have documents associated with them. Okay, and then you can click it back to show all the categories there. Does that answer your question?
Yep, think so. Thank you.
Super. I'm putting my thumbs up and I've realised I've turned the camera off. Don't do that again. So that's our classification structure. Well, again, we'll dive into the admin functionality afterwards, and I'll show you where that's designed and where you can structure it.
Can I ask a question, James?
Of course you can.
So that's obviously shown the test document there that's opened up.
Yeah.
Is there anything from the front end that we can see who's actually uploaded that?
Yeah, absolutely. I'll cover that now for you, and we'll go on to that next. So if we click that document properties there,
yeah,
I'll just pin it. So these are all the bits of metadata that are stored at the in the repository when we capture the document. So we've got all the demographic information there.
Yeah.
If we scroll down, title, when the document was created in the system, who uploaded it,
Brilliant.
if it has been modified since,
Yeah.
that would get that information in there. Documents that are going to come through the scanning pipeline will also have all this sort of information in when it was scanned, what time it was, who was the operator who carried out the scan. There's various bits of information that come through the scanning pipeline.
Brilliant. Thank you.
And then we've got a full set of demographic data. It's not populated on my test system.
No.
But as we go through, and we've got a full set of patient data, whatever we can capture at the time the document is scanned will be populated into this view here. So there's quite a lot of information that's potentially can be populated.
That's
But
great.
like
Thank you.
those main bits about who created the document, who scanned the document, they'll always be captured. There's sort of the default metadata.
Well.
Okay. Unpin that. So what we see, you probably see all the documents are loading up in our document list here. We've got the title of the document as it was recorded when it was scanned, the type of, which is the document type, the date when it was scanned, sorry, the date when it was uploaded into the system. Now you'll notice we've got some down here going back to 2016. What we've done for the documents that we are migrating into the system from Chubb, so there's 1.8 million documents in Chubb at the moment. They're all being migrated as we speak. We're maintaining the original creation date of the document as it goes into Filer. So anything but going back to sort of, I think it's 2015, 2016 when that system was implemented, the values will be in there. So we'll know when it was originally created, not when it was migrated. Okay, as we click through here, you'll notice the documents update in our document viewer there on the right hand side. Okay, you've also got the option, hyperlink in the document will open the document from the library in the browser that you're using. I'm using Edge at the moment. It'll work with Chrome and Firefox as well. I think Edge is the trust's browser of choice, so that's likely what you'll be using. But that opens it up in the PDF viewer, the native PDF viewer for the browser that you're using. Okay. There's various other bits and pieces that you can do with this document viewer. Let's go back to my original document. We can do things like zoom in, zoom out. We can full screen it through here. Click escape to take it back. We can see thumbnails. So if your document's got more than one page, we can see, clicking my mouse, we can see the thumbnails of the documents down the side there and easily navigate to them. We can search in the content of the document. So every document that's uploaded into the system is OCR'd. So if you're uploading a scan document, for example, it goes through an OCR process, which adds a text layer onto the top of the document. All that data is added to SharePoint's search index. So imagine like Google has a search index, SharePoint has the same sort of thing, and which makes all these documents text searchable. So Lorem's obviously going to come up quite a bit, but you can then search in the content of the documents via the viewer. You can print directly from here. There's another few bits and pieces, a few operations, rotate the document, for example. And then we've also got on here, a bit difficult to see, but these little arrows here, next and previous. And this actually, rather than paging through the document, will page through all the records you've got. So it'll flick to the next record on the screen there. Records will all be displayed in date order, so when they're created. So for the clinician, they'll always see the most recent document at the top. So they'll be able to page through them via that method or by clicking on the documents they're interested in seeing.
If we had to send it to another trust without printing, so obviously save it, can we click all the documents at the same time to save, or do we have to do them individually?
You'd have to do them individually at the moment. So
Right.
that little icon there is a download option. So click download. We pop up a little confirmation dialog just to say that aware that if you download this document, it's going outside the system, so any controls that are in place in that system will no longer apply, and then you can download a copy. It's going to open it in the browser because that's my default browser setting, but there'll be a copy downloaded to my local downloads folder.
Okay.
If you have that requirement, there are other ways we can do it. These documents are all stored in a SharePoint document library behind the scenes, which, you know, a support call to Encodian, we can get access to it and we could bulk download. You know, if there was 1,000 records you needed to download, it's obviously not efficient to do it via this UI. There are other ways of achieving the same thing.
Right, okay. Thanks.
Okay. So we touched on download there. This functionality can be turned off. At the moment, we've got it turned on, but again, via config, we can turn it off. So if you don't want your users to be able to download records, it can be disabled. Depends on the sort of policies, whether you want the users in the trust to be able to do that. Suddenly, if you leave it enabled, you might find suddenly people are emailing records around all over the place without using the system. Just moving across the screen there, we've got this little bookmarked icon, so we can click that, and that bookmarks the record. Okay, bookmarks, just like in your browser, can be accessed from a different screen here. Let me just pop open that screen. And you can see that we've got the records bookmarked in here, and they're stored on a per user basis. So I'm logged on with this Encodian account at the moment, so only I'll be able to see those particular bookmarks. And much like the viewer, you could go directly to the document in the browser there if you wanted to take a look at it, or you can click to view it in the record viewer and it'll take you directly to that particular document that you've bookmarked. Okay, if you want to get rid of the bookmark, you can click it again and that deletes the bookmark. You can also delete bookmarks from this screen here. You've got the options to do it there.
Can I ask if there's a way of sharing files that you've bookmarked?
Not sharing files you bookmarked, but you
Right.
can share the case. So we'll go on to those bits now. So what we can do, so we've got these little icons up here. We've touched on the hide tabs one up there, which we can show and hide. The next one across is share case. So we can't share at a record level with this system, but you can share a link to the case. So it's not going to load it for me. Uses the address book, so we can put in, I've not got an email client on this machine, so I can't see it coming through, but you can put in a message, you can send a copy to yourself, and then click share and it'll come through. Sorry, can you just give me 2 seconds, guys? Sorry about that. That sends an email to the user with a link back to that particular case. It's all security trimmed, so if you inadvertently share the record with somebody who doesn't have access to it, they'll click the record and they'll get an access denied error message. We talked about bookmarks. So we can bookmark the entire case. So we bookmark the document there. By bookmarking a document, by virtue of doing that, you also as a bookmark record for the case, but you can just bookmark the case at the case level there, and that adds the bookmark onto that. And again, if you want to remove it, just click it again and it gets rid of that bookmark. That little link there does the same as that navigation item there, just takes you to your bookmarks page. If you want to go and view all your bookmarks, we've removed them all so there's none there to see. There's a couple of these tabs down. And then the next one is our manual upload feature. So this is where if you have a document on your desktop, we've received it via other means, you can upload the document directly into the patient's case file. So the first thing to do is select the document. So I've got a test document here. It only accepts certain formats, which are listed there. We can put in the title. So by default, it takes the title from the name of the document, but we can give it a different title if we want to. We're only working with one classification at the moment. Potential to have multiple classifications, but we've only got the one, so it's recognised that and defaulted that. Case file types. I'll come back to case file types, but that's how we security trim things. So we'll touch on that. And then we can select how we want the document to be classified. So we've got our same structure here we've got across the top of the screen. So we can say admission documentation, medical notes. Now we've got 3 levels of documents: category, subcategory, and document type. Now a document type can sit at that 2nd level, or it can sit at a 3rd level. So you can have a category, a subcategory, and then your document types, as you would with if we go to legacy, acute, and then there's a list of document types. Okay. The ones I've got are just chosen there: admission documentation. These are document types sitting underneath the main category, so we can just select one of those, and then there'll be no document types to select. Specialty, so we can set it against the particular specialty in the trust. I'm going to go over A&E, and then we've also got a mapping for consultants. So if there's a particular consultant that relates to for that specialty, we can select that. These values rely on a particular SharePoint list being kept up to date. So we have a list of a list of specialties, and then we have a list of corresponding consultants for those specialties. If consultants move around, new consultants join, etc., those lists need to be maintained in order to keep that information up to date. And then they can input the contact date. So if it was the date of the clinic, for example, I can pop that in there. So that's a Word document I'm uploading. We natively store PDF documents in Filer. So as the document is uploaded, we carry out some checks on the document, just make sure it's suitable for conversion to PDF. If it was a document that didn't have a text layer on it, for example, we would OCR it, and we'll also convert it to PDF as it goes through that pipeline. So we click Save on there. Are you sure you want to upload the document? Click OK. So that pings it off to our upload API, which is doing all that checking, converting it to PDF. And then once it's finished, it will give us a little message to say that it's been uploaded. Document successfully uploaded. Click OK. It will refresh the viewer. And there at the top of the screen, we've got our new document that we've just uploaded. Okay. If something went wrong during the upload process, if there was a problem with the document, couldn't find the patient, anything, it'll come back and it'll tell the user that something's gone wrong. And typically, if we can identify what has gone wrong, there'll be an error message there to say what's gone wrong. Any questions around that upload capability?
Are
No.
all those fields mandatory in the upload?
No. So the ones that are mandatory, and if you don't complete them, it will tell you. So you have to classify it. You have to give it a case file type. A title will be defaulted. Category and a document type. Specialty, consultant, and contact date aren't mandatory.
Okay, thank you.
Okay. So that's those controls at the top. So the final thing to show you on here is the refiners. So refiners are a way we can further trim down this result set that we've got here for this particular patient. Okay. It uses SharePoint searches capabilities to do this, and we can configure refiners via the admin functionality. So if we've got a piece of metadata that we store against the document, we can turn that bit of metadata into a refiner. Some bits of metadata lend themselves to refiners better than others. So for example, specialty that we've got in here, you know, documents for one patient could have multiple specialties associated with them. So we're going to see multiple values, but there wouldn't be much point in having a refiner on the patient name because the patient name is going to be the same across all those documents that are returned for that particular patient. Episode ID is another one there, which is quite useful. So if you if you're populating that as metadata as the documents are uploaded, you can then use that to search across. Sorry, clicking on a different thing. You can then use that to search across different episodes and documents that relate to those different episodes. And then we've also got a free text search. So that'll do a free text search not only across the content of the document, but across things like the file names, the metadata that's stored against the document. And it will return results where it finds that text that you've entered there. So if we do a specialty, for example, let's click accident and emergency, click refine. So that just trims it down to the one document we've got in there that has accident and emergency set against its specialty, which if we can check in here, there we go. So accident and emergency there. And you can combine refiners, so you can do free text and specialty searches at the same time. Clicking reset will just take you back to all your documents. So we go in there, let's just do a free text. So search for the word consultant. Fine. So it's just showing us all the records now where it's got the word consultant in the records. And it's got rid of everything else. Again, like I said, configurable, so we can build more refiners based on the metadata we've got against the documents. Okay, so that's what we call the record viewer. That's what the clinical staff and other users all interact with to look at the records relating to the patients. It's reasonably intuitive. We like to think it's not massively complex, and hopefully it allows them to explore the record in a fashion that they're kind of used to with doing with paper records, but obviously in a digital format. Is there any questions around that before we move on to the next bits of functionality?
Nope.
No, it seems fine, James. As you
Super.
say, it's quite intuitive, isn't it?
I think so, yeah. Sorry, was somebody going to say something just then?
I'm just saying it's easy.
Good. That's what I like. So that's the UI there. We've talked about bookmarks. There is a separate manual upload functionality, which allows you to upload documents to multiple patients at the same time. Whether you need to use that or not, that's up to you guys. We can turn it off if it's not necessary. But basically, the same as the one we went through before. We can select the document, classify it. Let's go correspondence, discharge document, A&E, contact date. But what we can do is put the CRNs in here of the patients we want to upload it to, and then we can select those, add them to this list here, so we could add it to a different one as well. Use that one. And what it'll do, in the same way we uploaded that document before, I click save, and it's going to upload the document to both of those patients. Obviously, because it's doing it twice, it takes twice as long to do it. And that's done. And then it takes you back to the administration pages where it's typically launched from. But if we go into, let's close some of these tabs down. Let's just refresh that screen there, and we should have another. There you go. That's that discharge one we just uploaded. But likewise, if we go into patient 002, this is Minnie Mouse. There's the same discharge document that we uploaded by that control. Okay. So that is the extent of the functionality the end users will be interacting with. Okay, so I'm going to leave that open, close some of these tabs, and we'll start talking about the admin functionality.
James, can I just ask a question there?
Of course,
on that
yeah.
multiple patient documents there.
Mhm.
You said that it could go on several patients, the same document.
Yeah.
But that's if we have multiple documents, it's only going to be that same document on multiple patients. It's not going to be different documents on multiple patients, is it?
No, so it's the one document.
Yes, that's kind of scary that we're going to be using that. It's maybe something we need to discuss.
We can turn it off. It's absolutely fine.
I'll
it can
put
be
it on my list for
it can be
development.
disabled. I'll tell you why we implemented it. So we have a version of this for working for children's social care.
I can
And
understand that part.
It's not
yeah.
uncommon. They have families and they
Yeah.
have to upload the same documents
Yeah.
to multiple different children at the same
I'm
time.
just thinking of staff maybe
Yeah.
trying to think they could put multiple documents, but not realising they're going to go on all the patients and
Yeah.
think they're going to go on multiple patients.
It would only go to the patients that they've selected.
Yeah, but I think they might think they can put multiple documents, and
Oh,
they'll
yeah,
just
yeah,
hit the
yeah,
right
I get that.
patient, which they won't, will they?
Yeah, no, it's not. Unfortunately, it's not that clever. But
No.
yeah, no, absolutely take your point. Yeah,
Yeah.
we can remove that functionality
Well, no, I'll
by
speak to you before.
configuration. Yeah,
Can I just ask about the recycle bin?
yeah.
Yeah, I was going to ask that.
Yeah, how would documents get into there? And
So
yeah,
I'll touch on this a bit when we talk about admin. So there is functionality in the admin tooling to delete documents. So SharePoint stores documents in document libraries. So if you're familiar with SharePoint, they're just like lists. They're very similar to file system type things, but structured with folders and etc. And we use exactly the same structures. When you delete documents from SharePoint libraries, you're quite right, they go to recycle bins. There's multiple stages of recycle bins. There's like the end user recycle bin that they can then retrieve documents from, and then there's an admin level recycle bin. Now, however, when we delete documents from the library, when I show you that functionality, we bypass the recycle bins, so the document's permanently destroyed. So any documents that are deleted via our user interface for the system won't go to any recycle bins. So the only way that those documents can then be recovered would be by going back to backups.
What do you mean by use? Do you mean the staff in here or you?
You guys.
So you're saying if staff use the recycle part,
No,
it'll be
no. So
permanently
yeah, right.
deleted.
Let's talk about delete record. I was
Yeah.
going to come back to it, but as soon as the questions come up, so we're in our admin functionality here. So this will only be accessible to you in health records and maybe some IT users in the IT
Right,
teams
okay.
as well, not to end users, not to clinicians,
Yeah.
secretaries, etc. Okay, there is a piece of functionality in here called delete record. Okay, what we
Yeah.
can do is we select what's called our business area, which is patient records in this instance. We can find a patient by their identifier, or we can use when the documents are created or the file name, search for that, and it's brought back all the documents for this particular patient. We can select the document, and there's two options. We've got change active status and delete records. I noticed there's a typo on there, it's got an extra D on it, which I need to change, but change active status. So what this will do is it'll put a flag on the records so that that record does not appear in search results. Okay, so when you go and search for the patient, it'll bring back all the records, but that one won't be included, but it will still be in the repository of documents behind the scenes. Okay, and you can still then go back into this screen and reverse that active status to make it visible again. So that's option one. Option two is to delete the record. Now, when you click that delete, it will be permanently deleted. Okay, it won't go to any recycle bins. Okay, so we don't have a situation where documents, we think we've deleted a document, but actually it sits hanging around in a recycle bin for the next 180 days when it should have been deleted. Okay, if you permanently delete a document, it's gone. We can't get it back for you. Microsoft can't get it back for you. What we would have to do is restore a backup from that's stored away from the system to retrieve that document.
So hence why it's permission based.
Yeah, absolutely. So it's only accessible to administrative users to do that functionality. But your question about the recycle bin, I'm assuming it's coming from the point of view that our documents sitting around in a recycle bin or medical records sitting in a recycle bin when they shouldn't be. No, they're not, because we don't put documents in there.
James, could I just step in here with a quick question, please? It's
Absolutely,
Ian.
yeah.
When you're talking about change the active status, that sounds like something that might be useful when we're dealing with transgender and adopted patients.
Mm-hmm.
And just could you just remind me again how you said if the active status has been changed, how would you get it back again?
It's exactly the same screen in. Yeah. So what we could do here, so we can change active status on this. Okay. It goes away, does its thing. And that there's a bit of metadata associated with the document called active. It's a true or false value. And typically it's not worked while I've done it here in my dev system.
That's all right.
In your system. Anyway, that little flag there would say false.
I think I've grasped that now.
Yeah.
But you do say that document would show in searches, is that right?
No, it would be excluded from searches. So
right.
We turn, so we make it inactive, for want of a better word, and then it's not retrieved. So when we go and look at the patient's records via this user interface here, that document wouldn't display.
Lovely,
Okay,
lovely.
because
And if-
the active flag is false. If subsequently you wanted to make it active again, you can go into this screen and reverse the process, make it active, and then it would display in this user interface.
And is that dependent upon access level, for instance, the senior team in health records, or?
So this functionality is so we will, the idea being we will give access to the administrative functionality to the health records team as a whole. It won't be levels within the health records team.
No, okay, that's fine.
So between yourselves, decide who has access to this. We can assign those users to the right groups to do that activity.
That answers the question. Thank you.
I'll come back to your question about how dealing with the records where the transgender patients and how we can secure those in different ways, because it's something that me and Nikki have worked on, and there is another way of doing that using certain permissions.
Good.
That can be done, so we can touch on that. So just going back, just taking a little step back on the admin functionality there, I just wanted to start at the top because we talked about business areas. The business area is the context for the records that have been digitized. So at the moment, the trust is using it for patient records, so that is the business area. It's quite possible the trust might decide to use the same system for human resources records, where the employee was the context, not the patient. So we could have another business area in there for HR, for example. At the moment, you've only got the one, which is patient records. But this particular screen here allows us to configure that particular business area. Largely, you won't need to make any changes to the functionality in here. It's set when we set up the system, it's configured then. The only thing you might change is we've got some flags here that turn off certain functionality in the record viewer. So things like the upload control, the download control that we talked about earlier, these can be disabled via ticking various boxes in here. We can even turn off the bookmark functionality, and whether there's a demographic banner displayed to the end users. So that's probably about the most you would probably do in this screen. The rest of it, kind of essential that it's configured the way it is for the system to work the way we want it to work. So it's not something you would necessarily go in and amend. Case file types, this is what I wanted to touch on. So I'm just going to bring up another screen just to put this into context, just while we're, what I wanted to show you is what it looks like behind the scenes. So when a patient's records are uploaded into Filer, what we do is we create a folder in a record library for that particular patient. So we've got this one here, which is the, actually we'll look at the two, that's it. So we'll look at two. So that patient's records for the patient with that CRN are all stored in a folder in a record library behind the scenes that end users don't interact with. You guys won't typically need to interact with either. It's just like the file system where the files are actually stored. And what we do is when we upload the documents for a patient, we create a folder for that patient. Okay. And then within this folder, we create a set of subfolders, which we've got there. Now those subfolders map to what we have in this admin tool here called case file types. Okay. And this is what allows us to apply further, more granular permissions to the documents that are stored against the user's record, the patient's records. So in collaboration with Nikki and Yvonne, we've determined that we need these 4 case file types. So we've got medical records, secure records, safeguarding records, and safeguarding secure records. Okay. And each of these groups, these folders, is then we set permissions on those folders so that they're only accessible by certain groups of users, and that's aligned to security groups in the Trust's Active Directory. Okay, so one of you could be a member of Filer Medical Records users. Okay, in which case you'd see all the documents that are stored in that folder when they're uploaded. Okay. Somebody might need a higher level of permissions, and those documents could be stored in the secure records folder, in which case the user will only see the records. The user who has permissions to will see records in secure records, but they will also see the medical records users. You can sort of see how this is sort of a hierarchy of permissions. Now, what was decided for those situations where you have transgender patients who are or have transitioned, their records from their previous gender would be stored in a secure records folder, which would only be accessible by certain named individuals in the trust. And then their records going forward for their newly assigned gender would go into the medical records folder. So for all intents and purposes, all the documents in the medical records folder are the ones that people would be working with on a day-to-day basis. If there was then a subsequent medical need, which I think Nikki said had only happened once in her time working with this, working in this sort of environment, we can give access to the documents in the secure records folder to the clinician that needs to be able to see those documents. Okay, and they would then be able to view them through the same way that we view the records through this document viewer here. They would search for it and those documents would become available to them. Subsequently, once that patient has seen the clinician and that clinician no longer requires access to those records, those access rights can be revoked.
And those access rights would apply only to that particular patient, not generally?
It would apply generally at that point in time. So the clinician would have access to any patients who have records in the secure records folders. Okay, now what you can do is when documents are uploaded into the system, so if we look at that upload form that we had before, you have a case file type drop down. Now it defaults to medical records, which is the main one. Now in 99.9% of cases, the records are going to go into medical records. Okay, but there are going to be certain situations where it might go into one of these other folders. Okay.
Can I just ask, will it show in the medical record if a patient has a record within any of the other folders?
No.
No. Okay.
No.
Can I ask a question?
Yeah, of course.
For transgender and adoption, if they've already been put on medical records and we're going to change it to a secure record, can we go in and change that document to a secure record?
Great question. Not currently. Not via the UI. It would require a support call to ourselves to migrate the records between the folders. We are looking at adding that functionality though, because I think that would be a useful addition to change case file types of records. But yes, it's absolutely possible to do. It just requires a bit of back end work.
Okay.
But at the moment, Nikki intimated that it would be such a very rare occurrence that would need to be done. So it wasn't something that was prioritised. Does that make sense then around the so it's already configured. There's nothing you guys need to do particular. Obviously, if at some point in time somebody said, well, we need access to the any potentially secure records for this patient, it would have to go through your business process to allocate that access, and it would go to the IT team to put the user into the right Active Directory group so that they could then see those records.
Yeah, we've got a SOP on that.
There you go.
Started a SOP on that. Yeah.
Super.
Okay.
But that's how they work, and then behind the scenes, the records would actually be in one of these particular folders. Okay, so that's business area settings. Let's pop back to the admin screens. So reporting. So we've got some auditing. So everything that happens in the system, we audit what takes place. So things like people clicking on screens, accessing particular records, documents being routed into Filer. We capture an audit event for them. So who did it, when did it happen, that sort of information, and all that's stored in a database behind the scenes, and we can access that information, or you guys can access that information via these audit reports. So the first one we got is the audit log basic report. And what this will show us is the last 1,000 audit events for the particular business area. So we've got patient records in there. We've also got administration. So anything that's taking place in the admin portals, the admin screens that we're looking at the moment is also audited. If we click patient records, it shows us the last set of events that took place. The last 1,000 events that took place for patient records. So if you just need to see what's happened recently, it's a great place to go and see. So you can see there, that's when me as the Encodian user set that particular record as inactive for that particular patient. These are all the screens that we've been clicking on throughout the demonstration. Okay.
James, can I ask a question? Can we
yeah,
do
of
it by
course.
date, or does it just go by the
You-
last 1,000?
No. So this is the basic report that does it by
Right.
date. So it just shows the last 1,000. If we pop back
Right,
here,
okay.
custom report just gives us more control over what we're doing. So we could say
Brilliant.
patient records for, let's just look at that particular patient. We can even go down to who did the work. We can say just for today's date. We could even go down to the different event types. So it's only going to show us those events that have taken place on those dates for that particular patient.
Can I ask another question? Sorry.
Yeah, no, it's
You know,
fine.
you've just got the patient identifier. What if you
Yeah.
wanted multiple patients for the same day under a user, just in case there's been quite a few errors?
Yeah, no. So if we get rid of the patient identifier, we should be able to take the username here. I think I might need the full username, but let's see if it'll do it with this. Yeah, so there you go. So that's done the Encodian user
Yeah.
in that date range, but we see we've got
Alright,
multiple
Bill.
patients in here. And then actually, if you wanted to say, actually, I'm only interested in that particular patient, we can further,
You can narrow it down.
we could just narrow it down on
Yeah,
using those different
great.
criteria we've got. Can export it to Excel. So if you want to take it off, and obviously on the screen it's difficult to navigate, but you might want to export it to Excel so you can slice and dice it and have a look at the data in different ways.
Yeah.
It's all stored in the SQL database. So there is the possibility that if you wanted more complex reporting on this type of stuff, because it's all stored in SQL, we can attach things like Power BI and different BI reporting capabilities to those databases to do things. But as it stands, you've got a mechanism there that if you want to say, you know, can you tell me who looked at this patient's records on the 1st of November? You can jump in there and have a look. Okay.
James, can I ask a question? Sorry.
Yeah, of course.
Can you pull a report on if anybody's deleted anything, or will that come up? Or
Yeah, so that would be considered admin functionality.
Right,
So
okay.
on that screen we showed before,
Yeah.
where I could set it to inactive or delete it, it would be captured against admin functionality there.
Cool.
So you can see here where I'm accessing the audit pages. But if we go through, we should see where I've attempted to. It was on that. We go back to the basic report. It'll be on patient records because it's against the patient. That's where I set it inactive. But if I'd gone in and deleted the record, it would be a record deleted event against my user there. Okay.
You know, your reports are quite quick at the moment. You know, when it's up and running, does it take a bit of time, or are they as quick as what you're doing now?
So there's a lot of data.
Yeah.
And there's a lot of data in our dev system, because you imagine, you know, me just clicking around, you can see
Yeah.
how many events have been raised
Yeah.
against all that stuff. We'll just have to benchmark it, I think,
Right. Okay.
and see what it's like when it's in your environment. What
Yeah.
we do say is, obviously we're storing everything, we're not trimming it. It's sensible to implement, and we can talk to the IT teams about this, but it's sensible to implement some sort of, you know, housekeeping on it, that maybe you keep the last 6 months worth of data in the database and archive off anything older than that to some other type of storage, maybe you know, files or something like that. But at the moment, it will all be going into the database, so you can do it and access it. But yeah, it's a query against a database essentially. Okay, any more questions around auditing? No, cool.
No.
So classification builder. So the classification, as we said, we pop back to this screen here. It's effectively this set of tabs we've got across the top of the screen here. This can be controlled via this screen, which we've got here called classification management. Okay, and we can go in here again, we can select the business area. So if you had more business areas, it would show there. We can select classification we want to look at. And what you'll see is we've got a representation here of that particular bar we've got across the top of the screen. So on the left here, we've got our categories. So that's what sits across the top here. So if we wanted to create a new category, we can click new, we can give it a title when it loads up. And that creates a new category on the screen. So it's just as simple as putting in a new category name there. Okay. Actually, I'll tell you what, we'll no, click new. Let's add a new one. So we've added in a new category called demonstration. So we can select that and it pops it on the screen there. I'm not going to save this because I don't want to update the one we're using. But once we've got the new category, then we could say add a subcategory underneath that, or we could add documents types underneath that. So we could say actually we want blood transfusion and cardiology under that demonstration tab. And then when we save that, that would then reflect back to the end users via this bar we've got at the top of the screen here. But again,
can I just make a point though, that would all of this for the administration would have to go through the records user group just so that we've got some governance here, but I'm sure the team know that, don't you?
Yeah. I was kind of just going to say that, Yvonne. Yeah, so
Yes.
obviously that classification we've come up with has been a work over the last few months to determine what's required and what's needed. I think, yeah, the governance, absolutely. The takeaway is it's possible to change it. So if you're getting feedback from your users that there's a category missing or something like that, I guess escalate it via Nikki or Yvonne, and then we can change it if necessary. Any questions on that, on the classification builder?
Nope.
Super. So the record operations. So we talked about delete. We can look at that again, but I think we covered that. So the other two operations that you can perform on records and patients are to merge or to move records. So we'll talk about merge first. So all of these screens will ask you to select the business area when you're going in. So with merging, this is where we're going to take all the records from one patient and move them to another patient. So patient A effectively gets shut down and all their records gets moved to patient B. Okay. I've always been told that this can happen if somebody's admitted through accident, through A&E, for example, and they can't locate the record and another, identifiers assigned to the patient, but when they might get on a ward, subsequently found that they do have an existing record, so the two need to be pushed together. I'm sure you guys know of more scenarios where that might be the case, but essentially what you can do is search for your first patient, locate them, find your second patient, and then we can add some comments in, merged or demonstration. Okay. If we're happy with those two patients, click merge, and what it does is it records the request. So what happens with the merge? It can be quite a long running operation because if you imagine if one patient's got hundreds of records associated with them, we're not going to do that on the screen while you're sat there. What happens is it gets added to a queue. We have an automated job that runs, I think it's every 5 minutes, which then checks that queue and carries out the merge operation behind the scenes. So we click OK there, it takes back to that screen. We've got another screen there called merge status. So again, select the business area. Okay, so this operation that I've just created, so that's our source, that's where it's going to be merged to. That's who requested it when it was created. Okay, when the job then goes and runs, it'll merge those two records together, and the source will then no longer be accessible. Okay, and all the records will be in the target.
Could I ask a question, James?
Yeah, of course.
So we merge records on PAS, and we merge the two numbers together.
Yeah.
Now this obviously has got pushing through to Chubb or Chubb Plus.
Mhm.
What will that look like from the front end? Will they still be separate, or will they have joined together at the front end? And this is a back end piece of work we need to do.
This is a back end piece of work you need to do at the
Right.
moment.
So from the front
Yep.
end, it'll be the two that we've joined together. It'll be the main one that we've used.
Yes,
Yes.
that's correct.
Right.
Yep.
Okay, that makes sense now. Then. Thank you.
Yeah. So that's merging. I won't run it because I don't want to merge those two because they're my demo patients. But same principle for move. So if you've, and I guess this one could come about maybe if you scan a document or manually upload a document and inadvertently put it against the wrong patient, we can go in, locate that particular record. So again, we're looking at patient number 1 here, and it's brought back all their records. We can say, all right, that one's misfiled. It should be against number 2. Click that. Can add a comment. And again, same principle. Once we click move, it adds that move request to a queue. And the job that runs, again, I think it's every 5 minutes, checks that queue, which is in here, and tells us if we've moved the record. So it tells us where it's going from, who to, and which ID or IDs of records, because you can move multiple ones at the same time.
I'm assuming that's an administration job as well, James.
All this functionality is admin.
Right. So we'll.
Yep.
Right. Okay. So I need to stop for that then. Yeah.
Okay.
Just to say how much I like that facility very much.
Yeah.
Oh, good stuff. Yeah, so all this functionality here that we're seeing in this screen, it will only be available to you guys in health records and certain members of the IT teams. It's not end user functionality. Okay.
Can I just check? Sorry, if you merge two patient numbers, does that mean that you can't then see the original number at all?
No, the original number's still available because
It is.
that number comes out of PMI at the moment, but ultimately out of PAS. So you could theoretically then start uploading records against the original number again.
Okay. So could you then make that number inactive, or?
Not in Filer. The number would
No.
have to become inactive at the source system, so in PAS effectively.
That's
Yeah.
what we're doing first. We're
So
going
that
to
it
pass
couldn't
first.
be used. Yeah, so we wouldn't be aware of it in Filer because that's where we get those patient IDs from.
Part of the merge and stop is we merge and pass first before we do whatever we need to do in here. We have to merge and pass first. Get through.
Yes, you're right, Joanne. That's exactly what's happening now,
Yeah.
isn't it? Yeah.
Yes.
Yeah.
Yeah.
Okay. We talked about delete record already. Is everybody comfortable with the delete record functionality? So you select your patient. We can change the active status so the record's still there, but they can't see it, or we can permanently delete the record if we no longer need it or want it in the system. Okay, this section here about information management and retention operations, this relates to the configuration and setting of expiry dates on particular individual records, but also a whole set of records for a particular patient. Now, we will be, after we've deployed the system, working with the trust to redesign that functionality because the way Filer does it at the moment doesn't quite work the way the trust needs it to work for their records. So I'm not going to show you that because I don't want to confuse everything because you're actually not going to be using it. So we'll be designing a new set of screens and logic that will be used to define those. But essentially, it has inbuilt capabilities to set expiry dates, and once those expiry dates are hit, it will trigger workflows to ultimately either archive or get the destruction of the records once they've hit certain dates. But like I said, we're going to be working with Nick and the team to rebuild all that to a slightly different set of requirements. So once that's done, we can revisit and train on how all that works. Okay, so record viewer operations. These are bits of admin functionality that relate to the record viewer being this screen that we've got here. So the first is the demographics banner. So we're going to here, we select our business area as we always do, our entity, which is a patient record. And what you'll see is we've got this structure here, 3 rows up to 5 fields, and that follows the format of this structure here, where we've got 3 rows and we've got the different fields going across the screen. Okay, and what we can do is we can change those labels that appear. Okay, and we can also change the fields that we're displaying in those labels. So we could add in, let's add in another one just as a demo, and we'll add in, we've got gender in there. Hopefully there's a value in the data, but so we could do that, we can save that. And then if we reload that page, we now got gender on there as well. Okay, so it's just a way we can control what's data's displayed in there. Okay, cancel that. And then the results refiners. So we talked about refiners. So this is on the left-hand side here. We've got these different refiners. We've got free text, specialty, episode ID configured at the moment. Free text is always there. It's a default, so we don't change that one, but the other ones can all be added in, a custom. So this can be configured via this screen here. So again, we'll select our business area. That's where we are. And then we've got all the different bits of metadata that are associated with the patient's record. Now, like I said, some bits of metadata lend themselves to being refiners more so than others. Episode ID, specialty, case file type might be a good one. So if we had documents against the different case file types, we could do that there. So we could add in that refiner. We can select how we want that refiner to appear, so what sort of control we want to use. So if we look at these ones here, this one's a drop-down list, and that one's a text box. So for case file type, we can say we can be a drop-down list. Save that. So if we reload that now, the right screen to reload that, what we should have is now we've got a case file type drop-down list. Okay, you'll notice it's not populated. Okay, these are populated by SharePoint Search. Now SharePoint Search runs on a schedule, so it goes off and re-indexes the content and populates that data on a schedule. If I went and ran that indexing job and then came and reloaded this page, it would see it in there, but that indexing job takes a few minutes to run, so I won't do it as part of this demonstration. But the way we've set it up in the trust, it's doing what's called a continuous crawl. So every time data is added to the index, it's sort of continuously updating the index. So the time it takes to populate those drop downs is quite quick. But again, it's an admin job, so it's not something you're going to be doing all the time, and you have to sort of wait for it to be populated. Once it's sort of populated, that's it's done its job. That's the refiners. So that's the admin functionality that you guys will have access to. Any questions, or do you want to revisit any particular areas before we just sort of move on to the really high level admin functionality? No, good stuff. Okay, so the final bit of functionality I wanted to show you is it's called central administration. So this is what the IT team have access to. You guys won't have access to it, end users won't have access to it. I'm showing you just for information, just so you can see what kind of goes on behind the scenes. So you've got a nice holistic view of the system. There isn't much in here relating to Filer. What we have is we have some config settings that are used across the whole system. So we talked about this just being used for patient records at the moment. It's quite feasible it could be used for other things within the trust, like HR records. And there's settings in here that apply across all those configurations effectively. And that can all be changed. We set this up when we install the system. With all the ones we've installed, I can't think of any time where we've actually got in and made changes to it once it's been installed, but it's there. And we can work with the IT teams if stuff needs to be updated after it's happened. But it does things like controls the size of the databases where all the documents are stored and how many items we store in these record libraries here before we create new record libraries. You know, things like prefixes on databases. But like I said, nothing for you guys to worry about. It's not something you'll be expected to work with. It's more just for awareness. The other thing we've got in here, we've talked about auditing. This is where we can configure the different audit event origins and event types. So an origin being the system that raises, or the part of the system that raises the audit event. So we've got things in here like scanning, routing is how documents get in, the admin screens. So that's all the event origins. And then we can also add in new event types. So we've got in event types that cover all sorts of things here. Show a load on the screen. You know, creating a new entity, so that'd be creating a new patient as it goes through the routing systems. We looked at the classification screen, so creating new categories in there, subcategories, moving records. So all the different types of events that we can audit against and we capture events against. And that's just where we can go in and make changes to those. Okay, and then the final thing, which I always think is pretty cool, is where we can look at the health of the system. So SharePoint as a system uses databases behind it to store data and configuration information and that sort of stuff. We have to keep those within certain limits and certain sizes, you know, to keep the system well maintained and to keep it working as it should be at the right sort of speeds. So we have this health and provisioning management screen, which we can go in and we can basically check on the health of the databases and the different document libraries where the records are stored. So it tells us here that the size of the database and how many records are in our record libraries, for example. And it's somewhere where it has automatic health management, the system. So if we need to provision a new database, for example, it'll know when to do that based on the settings in here. If we need to create new record libraries to store documents in, again, it'll know to do that based on the settings that we've got. So it's just a nice little visual where the IT teams can go in and have a look, and if necessarily, they can action it and create new sites and libraries if necessary. But I'll just say again, you guys won't be expected to go into these screens. They're just it's just more for an awareness, so that you're got an idea of what goes on behind the scenes of the system. Okay, so that is Filer in a nutshell. Does anybody have any questions, or are there any areas you'd like to revisit?
More of just a comment rather than a question. As you said, it's quite intuitive. It doesn't seem too difficult.
I mean, that's the way we designed it. So hopefully that's good feedback, because
Yeah,
you
I
know,
agree.
you want the users just to be able to jump in with very little training and find the records and work with them. Okay,
Great.
so I brought up at the beginning, and I will distribute this now. Let me just minimize that. Where's that document gone? So everything we've talked about just now is in this document. So that central admin functionality, the global administration screens that we talked about, auditing, all that sort of stuff. The record viewer a bit further down. So that record viewer here and the different tab structures and the record list and all that stuff we've just been through is included in this document. So it's a good reference material if you've got any questions, but you can always come back to us, ask. It's not a problem. We're quite happy to set up additional sessions if there's areas you want to go over again, or you've got additional questions. That's absolutely fine. Like I said, I do believe the training teams are going to be producing their own training collateral around the system, particularly for the end users, but you know, you're welcome to use this document.
Yeah, they're working on that now, James, so that's good. Well, I think that's been really helpful for all of us just to have a run through of everything. Is it okay if I stop the recording?
Yeah, absolutely. Yeah, that's no
now,
problem at all.
so that we have, yeah, thanks.